Would you like to learn from those that are taking their lives, their businesses, and their passions to the next level? Best-selling author of Speakeasy and master connector Lou Diamond is here to connect you to some of the most inspiring and amazing people on this planet. Get ready to thrive loud with Lou Diamond.
It's a bad idea, but how can I help myself? Been inside for most this year, and I thought a few drinks, they might help. It's been
Welcome everyone to another amazing episode of Thrive Loud with Lou Diamond, connecting you to the most inspiring and amazing people that are thriving each and every day. I'm your host, Lou Diamond, and today on Thrive Loud, we have somebody who is one of the top voices on AI-assisted robotics, digital health, and the impact on care. He is the chief patent advocate at HIDO, H-I-D-O, dedicated to reducing drug development costs. This is going to be an interesting chat. We're going to really get into all the mixes of new tech, healthcare, AI. Oh my goodness, lots of stuff coming together. Thrive Loud listeners, I bring you Charles Gellman. Charles, welcome to Thrive Loud.
What a fantastic introduction. And Lou, very, very excited to chat about robotics today.
Okay, so I got to do a little rewind. I need to understand kind of how the world that you're living in right now became your gig. Educate our listeners on how this path is what you're focused on today.
Yeah, so like a lot of founders, it's a bit of a roller coaster ride. There was never intent to actually do this. In my early 20s, I had a medical misdiagnosis where the physician thought it was a kidney stone. And in fact, it was ruptured appendicitis. Ooh. So I spent a couple of weeks in the hospital in the ICU, really recovering and getting back to what I once was. And it was, the road to recovery. I was a bit naive when it came to medical coordination and understanding the process and really understanding recovery. But that is my why. And that's the reason why I spent so much time and energy into this. I was really following the path of my brother, who's an investment banker. And that's when everything changed for me.
So how old were you when this took place, or how long ago was this?
Yeah, I was 20.
Okay. So that was like 5 minutes ago, looking how young you look. Or everything.
Yeah, right.
All right. So a lot has happened over time in both healthcare, digital healthcare, and needless to say, AI as well. Now, this is a combination of a whole bunch of things you got going on here. So helping to understand that this became your passion and trying to, in this world of understanding where it is, there's a lot of pieces to put together. How did this combination of things come to be?
Great question. So this is the culmination of my experiences within my clinical informatics research. I started aggregating a lot of the disparate data sets within the hospital when it comes to mortality, readmissions, as well as HAIs, which is healthcare associated infections for all the different hospitals and all the different performance metrics across the country. And what that did is it gave unique insights to hospital executives of why things are the way they are. And what I was trying to figure out is, what if we can create a blueprint for health? And if we can create a blueprint for health or best practices, can we replicate that across the country so we have similar outcomes from the highest performing hospitals, and then smooth out a lot of the variables that exist when you think about labor and best practices and different software applications? So that's really how HIDO started in a nutshell.
I forgot to ask this question earlier. How are you today? Your own health?
I'm a lot better.
I want to make sure we're addressing the most important thing about our guests on this program. All right. So I've had it like a little bit of how I'd like to say it. I have enough information to be a little dangerous, but not enough to be a complete expert. There's a lot of great things happening and a lot of scary things happening all at once. And the fact that we're putting in the words AI and assisted robotics all together makes us think of, the future and weird things going out. But I do know the value of how AI can help save and speed up certain issues in certain ways. And obviously lots of other tools around robotics is also fascinated. Was this an area that you had any knowledge of before this, before what happened to you personally? Or was this something that you were tangentially near and were very curious about how this could all be incorporated into what you do today?
Yeah, so I was giving, I had my initial, experience personally going into the hospital setting. And then I started working with a variety of different other companies. So I was with a large pharmaceutical company, Johnson & Johnson, and worked at a couple other medical companies and device and software. So this is a culmination of different experiences. And these unique experiences really gave me the vantage point of seeing things across the country, across health systems, across a broader perspective of what is possible. So when you start thinking about AI and assisted robotics, some things started to catch my eyes. And what started to catch my eye was that there's so many different variables in how providers treat each patient. And it's very hard to replicate best practices throughout. And then now I want you to start thinking, your audience to start thinking about this is, when you're in the hospital or with you in the ambulatory clinic, it's really a sterile environment within those four walls. But the second you step out, you don't have a doctor, you don't have a nurse, you don't have a pharmacist at your beck and call. 99.9% of a patient's time is spent in their home. So that's a completely different unknown area, almost like a black hole that people just don't know exactly what's happening, but we do with HIDO.
Okay. How do you know? Let's go down that path. Tell me what HIDO does to help figure all of this out.
Yeah, so what HIDO does is it smooths out the process of taking medications by following the prescriber's regimen. So a patient walks up to the device, it uses Face ID or a passcode to unlock, similar to your iPhone or Android machine. So it's the right person, the right place, the right medication, the right frequency, the right dosage, dispenses. Then there's a clear pill cup where you can actually see the medications go into the patient's mouth, and that's all recorded. And then, so dose by dose, we know with the device exactly what's going on for the first time ever. So start thinking about the blueprint for health, and now you know the patient's age, the dosage, the medication, the disease state, the location, all those different factors that contributes to their outcomes. We have that information, and we also have the information dose by dose, exactly what's going on, so you can create the best outcomes based upon what's working and what's not working. So it's almost like a complete flywheel effect with the HIDO device.
Okay, now I'm going to play a little devil's advocate, but not too much here. I don't want to go too far off, but you could have two people exactly the same age. You could have them around similar weights. But obviously, what the dosage for one individual might not necessarily be the one that would suffice for somebody else. I know there's averages or whatnot there. Tell me, how can the what HIDO's doing be able to maybe use some of that information or avoid certain problems in certain instances where maybe sensitivities or other factors, other physical components that people have, allergies, this or that, might be mixed into so that it can give a real smart answer and it isn't just comparing apples to apples?
Great. So the best thing that you can do, and we've done a study with the Northern California Medicare Advantage plan with heart failure patients, the best thing you can do is look at that same exact patient. So we had a 12-month study of the pre-HIDO, so we knew all those medications, and then intervention with the HIDO in the post. And what we were able to do is, based upon the specific cocktails and medications from the prescriber, you look at their blood work, you can check the clinical efficacy and safety of the lab work, and then you correlate that with the hospitalizations or the remissions or other types of outcome measures. So you know definitively which medications are working well, which ones may need to be titrated up or down or potentially replaced, because you're looking at those specific patients.
Okay. Charles, how does HIDO make money?
Great question. So there's two different ways. One is we partner with Medicare Advantage plans that identify their 1% of the population that cost 39% of all medical expenses. So for every dollar they spend or get in premium, 40 cents goes to 1% of their population. So what HIDO does is we're able to smooth out that population so it drastically reduces the amount of expenses from hospitalizations and ER visits.
Wow.
That's the first area. The second area are pharmaceutical companies looking to fast track or accelerate drug development because they know dose by dose what medications are being taken remotely versus a patient having to manually either write down the information or report back to them on the phone exactly what's going on. So they know definitively what's happening. So great data integrity. And that's been a big thing in clinical trials for the last few years.
I just recently, I'm going to give an analogy here that I just totally now get how it all works. I had one of those little pebbles from the road get a little hole and put a nick in my windshield. And I was all annoyed about it. And I know that the thing was eventually going to spread and grow and crack the window. And I end up reaching out to one of those satellite auto glass companies who can come in and they could fill the little thing. And they said, here it is. And if your car's insured, it will cost you nothing. And my head just explodes. And I'm trying to understand why it would cost me nothing. This guy's going to do the labor. Insurance is going to pay for this whole thing. Well, of course, because they're making sure that, the big windshield that cracks is one thing, but they know that if somebody takes that preventative measure, they're limiting whatever it is. So they're helping the insurance companies. And I'm now realizing how much you're helping them. You're helping them with the right dosage, the waste pieces, and reducing those costs that even the pharmaceutical companies have, because you're getting all that information at literally the point of intake at this particular point.
And imagine how providers can treat people if they actually know the best regimen of medications there are for specific disease states. Now, on top of that, they can actually retrospectively look at the same patient's lab work and definitively know if it's the right dosage versus just asking the patient. And how many people are very honest with their providers of whether or not they're taking the medications because they don't feel comfortable telling the truth. And those are the people that are caring for you.
So now I want to go there because this is the big joke. I recently went to the doctor and, they ask those lovely questions, how many glasses of alcohol do you have a week? And I always feel I probably should say a number that's a little bit less than what it is. That's my own factor, whatever it might be. Now, the data integrity itself, or even sharing the data, tell me, with which has been a huge HIPAA thing for a very long time and a very sensitive matter, but this is a very valuable piece of information that every patient would want to go with. Explain to me what that aspect, the privacy of the data or keeping an individual's take, like nobody needs to know what type of medication I'm taking individually. How does that work within HIDO so that the patient's basically privacy is being maintained?
Yeah, so we're compliant according to the HIPAA standards, and there's specific encrypted metrics that you have to comply by to protect PHI. So that's no different than any other healthcare company, whether it's software, device, or pharmaceutical company. Everything has to be protected accordingly. So we comply with the same standards as everybody else.
So this is a fun little project. This is a passion thing that's very near to your heart. This is obviously a huge area because it is, as to your point, it's the only one that's actually validating that intake piece and all that information. What's next within this? You're doing it maybe for a drug cost. Where do you see this ability of what you're doing as something that can be expanded, or other areas that HIDO would actually look into? Would love to hear that.
So just imagine if full chain of custody of every single medication going out the door. So what I'm holding is an embedded RFID chip. So each one of our pill caps is auto-recognized by the device. It knows medication dosage, frequency, and pill count. So what if, we're not going to eliminate all medication errors, but what if we can drastically reduce medication errors that happen at home? Our goal is to completely smooth out the process for patients across the board so there is a strong level of health equity, no matter age, gender, race, or type of other underlying conditions, to really give access to a lot of patients that may not be able to have that right now because labor shortages are not going to be solved anytime in the near future, but through AI-assisted robotics, I believe we can level the playing field for millions and millions of folks right now that are being underserved. So that's where I see the future.
Okay, so now I want to go to another part, which is something that I know is not in your control, but it is something that is a huge area, and that is, that in other parts of the world outside of at least our lovely United States, there are drugs that are mimicked drugs or copied drugs or made in different places all over the world, from China to Israel to all different parts, South America, whatever it might be. Getting a handle on that, obviously the FDA in the United States has a pretty tight grip on where things are, but a lot of people would tell you, look, you can get pharmaceuticals outside of the United States at a way less price or whatever it might be, but incorporating that into the mix of all of these drugs, where does HIDO fit in with that process?
So that is a great question because a lot of the discussions are around cost and access to medications. But if you really start to boil it down, a lot of the medications are made available through health plans. So if cost really is not the issue, and you definitely want to source drugs through reputable suppliers. So I can't really comment on the different
Right.
countries and where people are getting them from. But if you're able to have access to the medications and people are simply needing to alter their behaviors of whether or not they're taking their medications or not, that can be solved. So as I see it is that we have a bunch of medications that are available in the marketplace. The cocktails of medications or the different types of combinations hasn't really been studied very well in a real world environment. And that's where I think things can really expand in the future for many millions of people based upon those different combinations. They just haven't had those unique data sets in order to really approach it from a research perspective.
Charles, you've been thriving as an individual. Thank God you're here today with all the health issues you'd had when you were younger, and obviously you're better today, but you've also taken this channel into following your passion and helping to create something that the world needs, and obviously could be saving developmental costs down the road, which means you're thriving. However, on some days, you might be a little off your game. I'd love you to share with the listeners, Charles, when you're not thriving, what practice do you seek, or maybe which individual do you seek out to get yourself back on the thriving track?
Yeah, so every single night, what I do is I think about the day, and instead of meandering my thoughts and staying inside, what I like to do is I like to walk and collect my thoughts and think about the day, and then really start to conceive on speaking it out and talking it out. And usually by the end of my walk, I start to figure out what the potential solutions are. So when things aren't going so well, I find that doing some type of exercise start to stimulate different thought processes, and then I'm able to connect the dots and put them together so I can alter what tomorrow is going to look like.
I like it. Movement. You like to get out there and get the body flowing and get everything rolling. Let's do the admin part of the show, Charles. Share with the listeners all the places people can find you, learn about HIDO, also explain what it means, because you told me before the program does. I thought that was kind of cool. We'll put it in the show notes, but it always gets more engagement when they hear it from you.
Mm-hmm. Yeah, so please go visit our website. It's hidohealth.com, HIDO Health. You can also take a look at our YouTube channel, which is also under the HIDO Health moniker, so you can just query that. There is the Future of Care newsletter on LinkedIn, so you can go ahead and subscribe to that. HIDO stands for Health Information Data Outcomes, and it also means covered in Japanese if any of you speak Japanese.
I did like that. I thought like the double meaning within this. By the way, we like our special guest star in the back there with the very well
white hair
beard.
Hold on a second. Let me give him one more cameo first. Hey, Greg, you want to say hi for the big audience?
Yeah, hi.
There you go.
He actually speaks some Japanese. He did a couple tours in the military in the Navy, so maybe he can throw out some more words for us.
I like it. Okay. You're ready to go down Fun Street with me here, Charles.
Let's do it.
All right. Can you share with me maybe what's one of your all-time favorite movies or one that you love to rewatch?
Yeah. I actually enjoy watching action movies. I think I've seen Saving Private Ryan probably over 100 times. Just went to the theaters with my son and daughter to watch Mission Impossible. My daughter fell asleep while my son was watching. So I don't know if everyone's going to like that, but we enjoyed it. Any type of action movie.
Action movies. You're the action movie guy. By the way, I haven't got a chance to see it because I have got a list of other movies from Barbie, Oppenheimer, and the Raiders, the Indiana Jones movie. I still got to get on my list. I'm behind getting in the movies this summer.
I heard Oppenheimer's a great movie. I would like to watch that.
Definitely. All right. We're going to do the speed round here. I'm going to ask you something. I want the first thing that comes to your mind. These are things that lift you up, motivate you, make you feel good. They basically make you thrive. Ready? Of late, a song that you love to listen to or one that pumps you up.
Oh, wow. I just listen to Top 40. So anything that's on the radio.
Anything that's on Top 40. Also known as the Taylor Swift channel. Okay, got it. Or Ed Sheeran, one of the two. A favorite food that's not a dessert.
Lasagna.
Favorite dessert.
Mint chocolate chip gelato.
An activity you wish you did more of.
Kickboxing.
An activity you wish you did less of.
Thinking.
That's good. That was, by the way. An activity that's relatively new to you that you've recently tried that you like so much you want to tell everybody else to try.
Not relatively new, but I enjoy playing pickleball. It's pretty exciting, dynamic sport.
I do like pickleball. So we've had a lot more pickleball folks on the program here, which is a fun one. Although we'll never understand the scoring system and how they came up with it, but it is what it is. If I could snap my fingers, Charles Gellman, and you could be anywhere in the world, where are you?
Hawaii.
I like it. Any one of the islands in particular?
I think
Does
any
it
of the
really
islands
matter?
Yeah, it's just being on the island.
Charles Gellman, HIDO, AI-assisted robotics, digital health, and impact on care. Hey, thank you so much for coming on Thrive Loud. Really great stuff. Reducing drug development costs. Let me tell you, anything that reduces any costs around drugs, we are a fan of, and it sounds like you've got some accountability here. Thanks for what you're doing, and good luck to you guys and everything you're doing.
Thank you, Lou, for having me. I appreciate it.
You got it. To all our listeners out there, thank you for joining us, and until next time, keep moving onward and upward, and remember, be brief, be bright, be gone.
Close. Oh, I keep dancing with my eyes closed. Oh, I keep dancing with my.
You've been listening to Thrive Loud with your host, Lou Diamond. Check us out on the web at thriveloud.com and follow us on Instagram, LinkedIn, Twitter, and Facebook at Thrive Loud. And check us out on the Good Pods app at Thrive Loud, where you can follow, listen, and connect directly to Lou and all of the Thrive Loud episodes. Thanks for listening.